So I am from Cleveland Clinic in Cleveland, Ohio, and I am fortunate to be a founding member of the International Myeloma Foundation Nurse Leadership Board. Diane Moran and Susie Novus had recognized the need for nurses to have a voice, and we're so happy. 2006 we started, and we're still here. So I am pleased to present on the topic of the discussion today will be being your own conductor. So what we're focusing on is the fact that you have a voice in your care. So it's not just doctor says this, nurse says that. We want to hear from you as part of your treatment team. So we all have gone through in previous presentations. We all know multiple myeloma is a cancer of the bone marrow plasma cells. There's so many different treatments these days, and that's why it's really important to find out what's important to you. We'll also focus on side effect management and how to monitor your blood tests. We won't talk too much about free light because we just talked very extensively, and it is a wonderful test for the diagnosis and management as well. The conductor of your healthcare team, tune up your knowledge and experience life's notes. So an important part of being integral in your team is knowing who your team members are. And we had discussions earlier today about how you need a primary care provider, subspecialists like kidney specialists, heart specialists, hematologists, oncologists, social workers. And so when you have a myeloma diagnosis, know who is on your team and don't be afraid to ask questions. This is your life. The IMF has so many wonderful tips on their website for you to access and checklists of what kind of questions to ask if you're not comfortable asking questions. There are many treatment options. We have different classes of drugs. When I started managing myeloma patients in 1996, we had just 2 or 3 options, and they weren't very good. And now we have a buffet of options. You can see on this slide listed all the different drug combinations, and I'm not going to go into those combinations right now. Just know that those are available. And we balance, as healthcare providers, our data from clinical research and the experience of that provider with your preferences. So ask yourself, what's most important to me when a treatment is necessary? Finances, travel, etc. Shared decision making, many of you have heard this. This is the dual discussion between your healthcare team and your caregivers or your friends or some kind of support system and what's important to you. And this is something that the Institute of Medicine is really interested in. So understand what's important to you. Take information home, review it with your providers, and then you can come to a decision. Remember, most of us do have a little bit of time or a lot of time to review these choices before you arrive at a decision together. The top priority should be what's important to you and asking questions. So how do you tune up your knowledge? I won't go into great detail about the different types of myeloma signs and symptoms, but most of you know here, myeloma cells can affect the kidneys, which is your blood creatinine number on your lab test. It can affect your hemoglobin, which is your anemia number. It can affect your bones, which we have x-rays, plain x-rays, CAT scans, MRIs. And it can lead to fatigue and infection. The treatments for these cells, for the myeloma cells, can also cause problems. Words such as myelosuppression, lowering blood counts, numbness and tingling to your fingers or feet, that's peripheral neuropathy, and other symptoms. And so taking into account what you're willing to accept as a side effect is also very important in how you feel. What if your side effects are not managed? That's something that many people are so worried about. What if I get a symptom I can't control? When you're starting a new therapy, there's a lot of anxiety anyhow, at least with me there is, even an antibiotic. But talking about your fears and concerns with your healthcare team can help alleviate it. Maybe you don't feel like you have enough time to spend with your doctor. That's where the nurse or a social worker or the infusion center nurse can really be helpful and provide you some tips. Poorly managed side effects can cause a lot of problems that lead to lower quality of life. So please speak up and feel like you have a voice in your treatment. Keep a symptom diary. Just one of those steno notebooks, write down when you take your pills, what side effects you're experiencing, and bring it to each visit. I have people that are on volume 32 because they list the dates, and you can go back and see how you were last year at this time. You know, rate your health on a scale of 0 to 10, with 10 being the worst. So find a symptom that works for you and stick to it. And expressing your priorities is so important. The next 2 slides are important for your knowledge. I won't go through all the little check boxes, but it's a nice little reminder of how we have different classes of drugs. They're categorized with color. So the mides, thalidomide, lenalidomide, pomalidomide, those are pills, and those are very effective one class of drugs. Side effects of fatigue and blood clots are real important with that class of drugs. The MIBs, the proteasome inhibitors, that's your bortezomib, carfilzomib, and ixazomib. These are IV or pill or shots, and side effects of those are mostly low blood platelet counts and a little bit of other side effects that are listed there. Another class of drugs are the MABs. That's elotuzumab and daratumumab, the monoclonal antibodies, which use your immune system more so to fight the cancer. Fewer side effects except for infusion reactions. The HDAC inhibitors, anthracyclines, steroids, and alkylating agents round out all of our classes of drugs. So you think, oh my gosh, how am I going to figure out what to take? Again, talk with your healthcare provider, see what they recommend, ask your nurse, and do your own research through the IMF as well. The steroids are a very common backbone of therapy. How many of you have been on steroids or had a loved one on steroids? They can affect your sleeping patterns, difficulty sleeping. It's interesting, one of the nurses, Debbie Doss, who's from the Dana-Farber, she said to me one time, I tell my patients to take them at nighttime so they sleep through side effects. And you know what? I've been telling people for 15 years now to do that, and it really works like a charm with some people. Again, discuss with your healthcare team if you adjust the dose and timing of medicines. But think about that. Taking with food, and definitely keeping in mind stomach discomfort. You might think you're nauseated, but you might be confusing that with indigestion, which can happen with steroids. But they are very important to kill the myeloma cells, so talk with your healthcare team before you're holding or adjusting the doses. Fatigue, depression, and anxiety are 3 words that a lot of people don't want to talk about, but they are real concerns for people with myeloma and even their caregivers with myeloma as well. And all 3 of these can affect your quality of life in a negative way. So sources of pain, fatigue, and depression can be from anemia, just having myeloma for many years, you just get tired. Treatment fatigue from being on the same therapy for years. I have people that have been on drugs for 15 years nonstop. This is wonderful. We celebrate that, but at the end of the day, sometimes one needs a break to go on a holiday or go visit friends. Management of fatigue, depression, and anxiety can be just from exercising, getting proper rest, and again, talk to your treatment team. If you're in an excellent remission, absolutely can we give you planned treatment holidays, and that can recharge your batteries and make you feel a little bit more confident. Now, some people don't want to go back on treatment after that treatment holiday, but have that discussion with your team. Prayer, meditation, and spiritual support are also very important. Those are ways that you can take an active role in your life. Massage and aromatherapy, get your caregiver or spouse or a loved one to rub your feet. Sometimes if you're having neuropathy or such, that can really help. About 70% of patients will have fatigue, but only 20% will want to do something about it. So try to remember that. Maybe it's your primary care doctor or somebody, not your oncologist, but just talk to someone. Infection prevention and treatment. Most of you in this room are very well aware that your myeloma is a problem with the immune system fighting cells, the plasma cells. Just like the doctor just told us, the immunoglobulins don't work, and those guys are supposed to protect you from getting sick. The 2 most effective things, washing your hands and avoiding people with colds. When you're traveling in the airport, take the little wipies, wipe off the kiosks, wipe off the seat racks, try to keep Purell in your pocket. Your healthcare team will recommend growth factors if your white cells are low from treatment to get those going, immunizations such as the influenza and pneumonia vaccine. Now we have the Zoster Vaccine and the Shingrix vaccine. The Shingrix vaccine is the dead vaccine. That's the one that is recommended for you as well. But again, don't forget to wash your hands and have people around you wash your hands too. Report a fever of greater than 100.4, but remember, if you're feeling sick and you don't quite have a fever that high, it might be because you're on steroids or immune suppressing treatments. So let your healthcare team know if you just don't feel right. Blood clots. Yes, ma'am. Oh, Shingrix vaccine. The Zoster Vaccine is the old one. So Shingrix is a new vaccine that's a dead vaccine. It was studied in patients that had prior stem cell transplants, blood cancers, and it's quite much more effective than the old Zoster Vaccine, which was by the company Merck, that wasn't as effective, and it was a live vaccine. So Shingrix is a two-step vaccine. You might not have heard a lot about it because there were manufacturing problems. You get a shot, and then you have a period of time before the second immunization, and the company ran out of drug. So now they're becoming more prevalent. You'll see that if you go into your Publix and your CVS and your different stores, they're going to be giving that now too. So talk with your healthcare provider. We usually give pills called acyclovir or valacyclovir to protect you from shingles. There are some practices that now say it's okay if you get that shot to not take it. But again, talk with your healthcare team. Thank you. So moving on to blood clots. On that note, when you're sitting too long, what are you at risk for? Blood clots. Are you sitting long now? Well, we try to give you breaks. If you're sitting for a car ride, draw the alphabet A, B, C, D with your feet. Try to kick around your legs because stasis or just sitting can be the biggest risk factor for blood clots. The blood clot can start in your leg most commonly, and then it can shoot through your circulation into your lung. That's called a pulmonary embolism, and that can be life-threatening. So if you're on an IMID, pomalidomide, lenalidomide, thalidomide, you should at least be on a baby aspirin and talk with your healthcare team about blood thinning, like real blood thinners. Symptoms of blood clots are swelling or tightness in the extremity. If you have a metaport in your arm or your chest, it's a higher risk. And again, the myeloma cells are sticky. Proteins, right? Proteins are sticky, they stick together, and they can cause an increased risk for clotting. The provider can adjust doses of medications like steroids. Lower doses of steroids can lead to a lower chance of blood clots. And again, lifestyle changes. If you're smoking cigarettes, try to stop smoking because that can make you at an increased risk, and then increasing activity. Stomach symptoms. Not a lot of people want to talk about diarrhea, but I'm sure there are people in this room, don't raise your hand, that know exactly what restroom you would stop at while you're driving down the turnpike, which was clean, which one's not clean. Try the hotels, they generally don't question you if you go in. But those are the things that I hear when people are on long-term lenalidomide, or they're getting, bortezomib or other proteasome inhibitors can sometimes lead to diarrhea. So if you're having diarrhea, there can be an infectious diarrhea. Talk with your healthcare team. Magnesium, we tell people to take for cramping. That can cause diarrhea. Make sure you don't have laxatives. That can cause diarrhea. But then if you're constipated, you might need laxatives. So definitely can't win, right? But you keep the line of communication open. A lot of constipation can be relieved by fiber, adequate hydration, and moving around. So if you're sitting around too much because you're in pain or you're depressed, try to increase your activity levels and increase fiber and increase water intake, because what will water also help? Your kidneys. Flushing out the toxins of all of the drugs that we give is really important. Many people with myeloma at diagnosis will have damage to their kidneys. It's the light chains, like that doctor was just talking about. The light chain assay can gum up in your kidney tubules, which is the tube that goes out through your bladder. So it's important to make sure that you keep well hydrated, have your primary care doctor work with you to control your diabetes if it's acting up from the steroids, or blood pressure if that's acting up, because that can lessen your chance of kidney failure. And watching your myeloma, knowing what type of myeloma you have. Is it light chain? Is it IgG kappa? Many times watching those numbers, you can find changes to those numbers before your healthcare provider will. Sometimes people are too busy, so be your own advocate. Drink water or anything that spills as much as you can. And again, many myeloma patients will experience some problems with kidneys at some point, but not everybody has to. Unfortunately, these myeloma cells make chemicals that literally dissolve and eat away at bones. In 1996 versus 2019, we didn't have bone strengthening drugs like we do now, so you don't see as much damage to the bone. It's not as visible. People will lose like 6 inches of height still sometimes, but it's not as common. 85% of people will have damage to the bone, so it's important to ask your provider, do I need to be on medicine to strengthen my bones? There's 3 main drugs that we give, pomidronate, zoledronic acid, or denosumab. Those are the 3 drugs approved to treat myeloma, and many of you should be taking calcium and vitamin D supplements. So have that discussion with your doctor. Ask them, why am I not on a bone strengthening agent if you're not on it? The bones will oftentimes be affected in the spine because of the gravity, but it can occur elsewhere. Peripheral neuropathy, that's when you have damage to your nerves. Your brain is sending mixed signals, and you can have sensory neuropathy, where there's some, the nerves innervate the skin, and then you can have numbness and tingling or pain. You can have a motor neuropathy, which is when you're trying to walk and move around. And those are the 2 types of neuropathy that people with myeloma will experience. So if you have damage to your nerves, oftentimes it can be from your treatment or the disease. The myeloma can attach to the nerve endings, unfortunately, but tell your healthcare provider. Sometimes we can adjust the dose of the medicine without stopping it altogether, because drugs don't work if people don't take them, right? So we want to jump in if you're having neuropathy and adjust the doses. We know that giving bortezomib, for example, once a week under the skin can really minimize neuropathy. Thalidomide, we use it a lot less than we used to, but adjusting the doses of that as well can help. Massaging the area with cocoa butter regularly can keep stimulating the blood flow, and exercise like walking. And when I say exercise, it's not running a triathlon or a marathon. It's just walking around in a circle in your house for 5 to 10 minutes at a time. Just getting up and moving around is just about as good a goal as anything. Now, sometimes you can have neuropathy from vitamin deficiencies. Oftentimes, healthcare providers forget to check if you have B vitamin deficiencies, B1, B6, B12, and sometimes they forget to check for thyroid or other abnormalities, so talk with your provider. Pain prevention and management. Who wants to prevent pain? Unfortunately, we have this whole opioid crisis around the country, and so now we're on the flip side. Pain used to be the 5th vital sign, what people said it was, and we treated it. Now nobody wants to treat pain as effectively. But if you are having pain, it might lead to a need for new x-rays. You can have myeloma that's totally in remission. So just because you're having new back or bone pain doesn't necessarily mean you're relapsing. So speak up and say, you know, my hips are really bothering me lately. You could have some weird thing that's called osteonecrosis of the hip from long-term steroids. It doesn't have to be myeloma. A lot of times people are afraid to speak up with a new symptom. So keep that in mind. Preventing pain when possible by using body mechanics to lift things. Use your legs to lift and don't lift over to lift a heavy box, and try to minimize how much you're lifting. Have that discussion with your healthcare team. Are you limited to 5 pounds or 10 pounds lifting, or no limits at all? I tell people to do more reps with lighter weight if they like to lift. Treatment of pain can be medications such as gabapentin, pregabalin. You know, there's non-narcotic things out there. Tylenol is very healthy, very helpful for many of you. One thing that you should all probably avoid is ibuprofen, Advil, NSAIDs. Those can be very harmful to the kidneys and can lead to kidney failure in many cases. They're bad with diabetes, high blood pressure. And what do we take for back pain? Aleve or ibuprofen. And just because it's over the counter doesn't necessarily mean it's safe. But again, talk with your healthcare team. Short-term with some hydration. I do give short-term courses, but I watch kidneys very carefully. Experience life's high notes. We're doing great. We're almost done. Good job. So experience life's high notes by living well. So important, I think, as a nurse. I mean, I see thousands and thousands of myeloma patients, and there's only so much you can do. And I think one of the things I like to be is encouraging. You don't have to live just 2 or 3 years anymore. I have people that have had myeloma over 20 years, and there's probably people like that in the room here. But people used to die of heart after the myeloma was in remission, or dying of influenza when the myeloma is in remission. So it's important to listen to your body and listen to those cues. If you don't feel right, speak up. Go to your primary care provider for your usual health screening. Watch your blood pressure, diabetes, cholesterol. Get your colonoscopy. They lowered the age recently, I think, to 45, but everybody at least by the age of 50 should have a first screening colonoscopy. Myeloma-specific therapies can lead to secondary cancers. That still doesn't mean we should stop those therapies. Most of the studies say you're still living longer by taking the therapies, but be aware of prostate cancer screening, breast cancer screening, and make sure you're up to date on your vaccines. You're at a higher skin cancer risk. I don't need to tell the South Floridians here to use sunscreen. I think most of you know. I mean, I love the sun, but using sunscreen is real important to prevent against skin cancer. Non-melanomatous skin cancers are very common. Adopting a healthy lifestyle is important for patients and their caregivers. It can be so stressful after having myeloma for so many years to have to deal with the finances and the going to the doctor visits. Now the spouse gets sick and you have their visits. And I look at these calendars when I'm making appointments, because I make everybody's appointments for the next visits. And I'm looking at, okay, Monday, Tuesday, Wednesday, Thursday are out. And then Friday you watch the grandkids. So it's like just trying to juggle everybody's health is important. So be open. If you get an appointment in the mail that says be at the office at 10 a.m. on a Friday and that just doesn't work for you, talk with your healthcare team. We want to do what's best for you, and if you have bowling night, then don't come on that day. And a lot of times people will think they have to just show up when they're told, but that's not the case. Try to keep a healthy weight and eat nutritiously. I know the IMF is very supportive of that type of eating. Stop smoking. And don't forget about the mental health. We talked about the fatigue, anxiety, depression. Talk to clergy or your places of worship. Find the social working groups like the support groups at the IMF, and then on chat rooms and blogs, make sure that they're reputable, but find a well-moderated chat room. So living well, enjoy the music. Music gives a soul to the universe, wings to the mind, flight to the imagination, and life to everything. And I did not make that quote, Plato did, but I like it, so. Anyhow, these last 2 slides show about how IMF has many resources to help you. I don't need the slides. I can point to the tables outside. You saw all of these understanding series, IMF TV conferences, the websites, the info line, 1-800-452-CURE, and the Myeloma Minute. And you are not alone. And I think, thank you. Thank you so much. Are there any questions? I'll let them tell me. Michael.
On the subject of pain management, what about medical marijuana and CBD oil?
Yeah, so that's an excellent question. So in many states, medical marijuana is approved, but it's still against federal guidelines. So each institution, like for example, I work at Cleveland Clinic, they have been working for the last year to regulate how I would prescribe it. Right now, like I can speak to my Ohio experience. In Ohio, we have people that are dispensers of medical marijuana, so we're referring out. And I'll tell you, some people really find it benefits them, but have that conversation with the healthcare team. CBD oil is available at many like Whole Foods and alternative places. And again, if it's not breaking your budget, and the healthcare providers, you have that conversation. I have a lot of people that use it, and some people think it's the best thing since sliced bread. So just be open, and we don't judge. people. So if you wanted to use different alternative adjunctive medicines, absolutely.
I have to tell you, my dog Lily is on CBD oil.
Good.
She
Does it-
seems very happy now. And
She hungry?
yes. Okay, right over here.
Please comment about sleeping medications and the new difficulties of prescribing them and receiving them.
Oh, sleeping medications. I am a big fan of taking a stepwise approach. So if you have problems with insomnia and you're on steroids, because that's really a lot of times, so when we go in for certain drips, we give you a pre-med of what? Benadryl, which is a sleeping medicine at 9 in the morning so that you don't have a reaction. And then your whole sleep is messed up that whole week, and then you start back the next week. So I do have discussions about sleep very often, but I'll start a stepwise approach. So Tylenol PM, ZQuil, those over the counter. Melatonin is extremely safe, and in a dose of about 9 milligrams can be pretty effective for a lot of people. You can start at 1 milligram and go all the way up. It is a natural hormone. If those don't work, then I tend to go towards trazodone is another one that's pretty safe. And the reason I go stepwise through these other drugs before I get to like Ambien and the others is because nowadays, and your point is that they don't want you to prescribe it if you're over the age of 65. So the insurance companies are saying, have you tried this? Have you tried that? We're not going to give you this medicine. So I try some little fancy ways that I won't talk about here because we're being recorded of getting around that. But talk with your provider about doing a stepwise approach. And once you've gone through all of those, you can demonstrate to your insurance company nothing else has worked. Change your steroid dose to nighttime instead of morning if it's the steroids. And then you can work with your healthcare team to find out a way that works for you. Thank you for that.
Thank you.
Jonathan?
I have a question.
Thank you. Hi. How much water do you recommend a myeloma patient to drink daily? And part two, you mentioned calcium as well for a myeloma patient. Does that increase the risk of kidney stones?
Okay, two great questions, everybody, by the way. You should pat yourself on the back. The first one is how much water should you drink? It's recommended the same as for the general healthy people. So 8 8-ounce glasses of water. But if you have high blood pressure, heart problems, you might have a lower dose that's recommended. Calcium used to be contraindicated because what's a sign of myeloma that's active? Hypercalcemia. Taking calcium pills can raise calcium. So a lot of providers used to be a little bit fearful of that. The new drugs like this denosumab for your bones, zoledronic acid for your bones, they all recommend to be taking external calcium. It should not increase the risk of kidney stones. As long as you're taking about 1,000 milligrams in your diet, you might not need it. Although I still see on this denosumab low calcium levels like that make people's hands cramp up. So I tell them to pop a couple extra strength Tums a couple times a week or around the shot at least if you don't want to take extra. I know I'm talking really quickly today, but you all have been so patient. I want to get in all my questions. I hope that was helpful.
Michael?
Michael.
It seems most people are recommending vaccines. In the past and currently, most of them have been preserved with Thimerol. How do we know that we're getting vaccines that do not have this mercury product in them?
You ask. Because we should be able to track the lot number and the preservative which is in there. And there's a lot of thimerosal-free vaccines that are being manufactured now. So just ask when somebody is recommending it, the pharmacist will be able to look at the vial and see if it's free of that or not. If you're allergic to it or you don't want it, then just let them know. Okay.
Alana?
Hi, thank you. Is there a time limit for receiving the bone medication, Somata?
No, there's not a time limit, but there are recent guidelines from January of 2018 that say there's 3 drugs available, and everybody with myeloma should start within their first year of diagnosis the bone strengtheners. Now, these guidelines change like the wind because we're always learning more about how we do what we do, but it's generally recommended that all patients, it used to be only if you had damage to your bones, all patients should be receiving a bone strengthening medication. We tend to give it less often after you've been on it for a while to lessen your chance of this damage to your jawbone, lessen your risk of damage to your kidney. But discuss with your healthcare provider because everybody should be at least on something at some point. But there's no clear consensus. These are just guidelines. Nobody really knows the best way of giving drugs and what drug is the best.
Okay, we have time for one more question, so it better be a good one. Michael.
Are probiotics of any benefit for GI issues?
Another good question, probiotics. I'm a big fan of probiotics. So it could be as little as the Activia yogurt that's in the refrigerated section if you don't like pills. But especially if you're having diarrhea, it can restore the normal stomach flora. So there are some different ones out there. I won't go into them right now and the benefits of each. But you can see, and I think there was a talk on the IMF website that talked about probiotics. And yes, I think they're great drugs, and you should consider using them if you're having diarrhea or stomach issues. Thank you so much to Susie and the IMF and all of our helpers, and to you for listening to me for the last half hour. Enjoy the rest of your day.